Hey, Dr. Berg here. In this video, we're going to talk about the most common cause of disease, what I believe is the real underlying root issue. And yes, you guessed it, it's sugar, but let me just explain the mechanism of what occurs in the body. The average person in the U.S. consumes 140 pounds of sugar in their diet every single year. But that doesn't even count the hidden sugars from the breads, pasta, cereal, crackers, biscuits, waffles, wine, alcohol, baby food. It's in everything. I mean, that's just outrageous. So what happens is all that sugar gets into your bloodstream, and then there's a hormone called insulin. And what it does is it basically just pulls the sugar out of the blood. And insulin is made by a gland called the pancreas. Now, the pancreas has these little cells called beta cells, right? Beta cells are the cell that makes the insulin that lowers the sugar. Now, it gets the sugar out because too much sugar is deadly. Our bodies were never designed to consume that much concentrated sugar. I had a patient come in the other day. She's consuming 2 liters of juice a day. I had another patient consuming a 6-pack of soda every single day, not every single week. And they're not even 8 ounces. They're actually 12 ounces. There's 6 12-ounce sodas a day. I don't know how she's alive. That is, our bodies just are not designed to consume that much jet fuel. And what happens is it really puts stress on this cell, this beta cell here, because it's constantly like pumping out tons and tons and tons of insulin. So over time, what happens is that the receptor that's supposed to kind of take in the insulin, so receptor is not receiving, it actually starts to become very resistant of insulin. So what happens with the sugars, it all occurs in the liver. So there's a lot of insulin sugar metabolism in the liver. And so it goes in the liver, it locks into the liver through a receptor, and is supposed to create a certain effect, like lowering of sugar, right? Well, what happens, you eventually end up with something called diabetes type 2, which is a lesser problem than type 1. Type 1 is more serious, type 2 is less serious, but it's still considered a disease. So diabetes type 2 is simply too much, it's a high sugar situation, it's too much sugar in the blood. So they label you as diabetes type 2. Now, what happens really is your body is simply trying to reject this insulin by causing the receptor to stop receiving insulin, okay? So that's what diabetes type 2, it's really a receptor problem in the liver. It's rejecting insulin, it's saying, I don't want enough, I had enough. It's like if you have people talk to you too much and you close your ears, it's like talk to the hand, don't talk to me anymore. That's what's really happening. And so what happens now, the sugar goes up, and that's very dangerous because you can have a coma, you can have all sorts of mental cognitive issues, you're going to be irritable, you're going to be tired, you're going to have nerve problems and vision problems, and there's a lot of side effects. So you're going to, belly fat, cholesterol, high blood pressure goes right down the list, okay? So that's pretty much what happens at this level, all right? So now they're labeled as diabetes type 2 by the doctor, and then they're treated by either metformin or glucophage, which are the same thing. Metformin comes from an herb called goat's rue, but you can't patent goat's rue, so they basically synthesize it synthetically, and then they basically they actually created metformin. What metformin does is it makes this receptor receive the insulin better. So basically what it does is it makes this connect better. That's all it does. But it's kind of forcing your body to connect when it shouldn't. And that's the problem. That's why it gives side effects. So if people take too much metformin, they can get a condition called lactic acidosis. That's a fancy word for you're getting too much acid in your blood and you're depleting your oxygen. So if you can envision working out really hard and your muscles get full of lactic acid and you can't breathe anymore because you're out of breath and you're huffing and puffing, and that's the same thing. A lactic acidosis occurs in the blood, so you decrease oxygen and you're going to have all sorts of hyperventilation and breathing problems. That's one of the side effects of metformin. And there's another side effect called liver failure and kidney failure. So these things don't come without side effects, right? Now, what's very, very, very sad is there's not this connection between what you put in your body and your diet and the correction of this issue. Instead, it's the labeling and the management of the symptom over time. It's not very profitable to make this link and to actually have the person stop eating all the sugar. It's much more profitable to manage the symptom and continue the diet. I would say 9 out of 10 patients coming in have not been changing their diet. The doctor didn't really talk about diet change other than portion control. Now, if you look at the American Diabetes Association, I think it's called diabetes.org, they have I think it's the 7 myths of diabetes. And this is like almost comical. They said, myth number 1, sugar causes diabetes. They said that's a myth, all right? They said it's a myth that starches will cause diabetes. And it goes on a list, and you can go ahead and read it. It's ridiculous. And the problem is that they're assigning cause to obesity. Like obesity is causing this diabetes as the culprit. And what they're telling you is genetic, or there's environmental factors, and obesity is a risk factor. It's linked to obesity. So there's really no cause effect. It's mainly there's risk factors. It's genetic. We don't really know yet. The cause is unknown. We don't understand this. So, unfortunately, the American Diabetes Association is funded. It was in the past. I don't know if it's still being funded. $23 million by the pharmaceutical companies and the food manufacturing companies. So, we know that that credibility has been lost just from that funding link. But the point is that this whole link here is ignored. And they'll pretty much tell you that we do recommend you reduce some of the juices that you consume, but not for the sake of the insulin problem or the sugar problem, but because of portion control. Because their whole thing is to lower the calories. So you see the confusion, what they're doing? I mean, it's so classic. So if you have diabetes, if you want to prevent diabetes, if you have family that you care about and friends that you care about, please show them this video, teach them these simple concepts, but this is the underlying source of diabetes, and then eventually it wears out and goes into type 1 diabetes, in which basically they have to be injected by insulin. And if we come back over here to the pancreas, type 1 is basically the complete exhaustion and breakdown of the beta cell. And so now you don't produce any insulin anymore, okay? So that's pretty much the simplicity of the most common cause of disease. And got to get the junk out of the trunk, get the sugar out of the trunk, and definitely, spread the word. This is Dr. Berg. I hope this helped.